Hi, everyone. Welcome to the Eczema Podcast. I'm excited that you're here today because we are going to talk about a lot of innovative therapies that we've never really talked about on the show today. So, we are going to talk all about stem cell therapy, how that can help you, IV therapy, low dose allergy, ozone therapy, and so much more. So, be sure to stay tuned because you're going to learn a lot from my guest today. His name is Dr. Clement Lee. He's a licensed naturopathic medical doctor and he has his own clinic. And I love that he does all these different types of innovative therapies that we haven't really had on the show before. So, hi, Dr. Lee. It's nice to have you on today.
Hi, Abby. Good morning. Thanks for having me. I'm excited to share what I do here for everybody out there.
Yeah, I'm so glad to have you on. I first heard about Dr. Lee from Dr. Jess Petros, who some of you may have heard on the show before. She gave a lot of great information. We talked about mold and a lot of other things that can affect your skin as well. So, Dr. Lee, I'm really excited because we've never really dived into this topic before. Stem cell therapy is something I've researched a lot into in the past, and I never found a really good guest that I was able to get on the show. I interviewed several, or I emailed several stem cell therapy companies, but I didn't really get someone who was able to talk more about it. So I am really excited to have you on today and to
Thanks.
hear more about how you use it in your clinic for your skin patients.
Got it. Well, I originally started using stem cells more for orthopedic use, but realistically, stem cells could be used for any major condition in the body. We started utilizing stem cells probably in 2015. Um, when it was still relatively new on the market. But just to clarify, like the stem cells that we're using are known as mesenchymal stem cells. So they're a certain type of stem cells, and these are particularly derived from umbilical cord tissue. So they're acquired from healthy post-pregnancy donors, where the labs have screened everything and make sure there's nothing, abnormal, no pathogens in the tissues. But those two particular cell types are able to help your body to heal from practically everything you can think about. And then the mechanism of how they work is that they're more like contractors on the job. They don't actually become your tissue types directly. So that's the clarifications, like not like there's like embryonic stem cells out there and there's different types of stem cells, but these particular stem cells are behaving just like the regulators of your system. So they secrete these things called exosomes, and we can get into that a little bit later, but exosomes are the signaling molecules released from the stem cells themselves. But it's the exosomes that are carrying information that bring to your existing cells to tell them how to work again properly, how to work again efficiently, so that they can fix the things that are meant to be fixed in the system. So that's kind of where you can utilize, or we've been utilizing is, so once we either give an IV or an injection of the stem cells and the exosomes that come with them, they can home in on the bodies where they're not working properly and then just re-educate them so they can start working well again.
That's amazing. So, just for some background for our audience, where do stem cells, where for eczema treatment in general or skin treatment in general, are there different places where we can get stem cells from, not just from postpartum?
Um, well, there's other stem cell types out there. I mean, the stem cells that we're using from are not from our own body. So those are allogenic. Then the other stem cells that you can get from your own tissues, those typically can be acquired from your fat or your bone marrow. So those are processes that are using your own stem cells. In this case, if you have generally a healthy immune system and you have healthy stem cells and you're not particularly old, your own stem cells can be quite helpful as well too. And so the typical ways is when they pull it up from your fat tissues or your bone marrow, they can concentrate them and then reinfuse them back in the system. So that's kind of like giving you a jump start of your existing stem cells. So that does work for some people as well. The things that we run into is patients who have done like their own fat stem cells when they're in a higher chronic inflammatory state. they can develop some mast cell issues later on. So I haven't used these particular fat cells myself personally on our patients, but I've had patients that have come from various clinics where they've had these stem cell treatments, and they've used these for like Lyme and mold and stuff too, and they do get better, but then 6 months later they start getting a lot of mast cell issues, which is something that maybe come from their own cells later on, or the fat cells that have been utilized in this process. So, you carry your own toxins too, so that's where it gets a little bit of a tricky situation when you're using your own tissues.
So, how do you usually mitigate it once they have mast cell issues that happen after the treatment?
Well, after the treatment, you just work on the traditional ways you have mast cell issues through antihistamine, either supplements, medications, but just also continually detoxing and helping the body energetically balance things out too. So sometimes you carry some emotional trauma that still needs to be addressed. So those variable things, and then there's also work on some of the limbic system retraining as well too. Because even though you may have just cured yourself with stem cells, the brain and the mind body's connection still might be stuck in a fight or flight response. So those are things that still need to be kind of worked in the background anyways.
Yeah, I love that you even brought in the emotional component as well, how that ties into it. So, let's say I'm a patient who came to see you for a stem cell. What would a stem cell therapy, what would the usual process look like in terms of treatment? For example, would I
Okay.
come see you more than once, or what does the process look like? Would I get injections?
So usually when we have a consultation for stem cells, we talk about, the condition and look at the background and make sure that they have some of the foundational homework done. So make sure that they have adequate amount of vitamins, minerals, building blocks, and at least some of the triggers might be addressed, or if they're being addressed at the same time, because that's quite important, because you can fix a lot with stem cells, but if the triggers aren't really dealt with, then things can come back later on. So we try to make sure that they have those things at least being worked on. But then the stem cell procedure is relatively straightforward. So once we evaluate them and we find that it's a great time to start, then the procedure is typically an IV. Um, and we do inject various areas. So there's other injection sites that we can inject that enhance your own body's existing stem cell populations. So there's areas they're called brown fat. Those are where your own dormant stem cells can be. So we inject some of those topically. And then IV wise, what we do, we actually do various treatments prior to the actual stem cell infusion. We do ozone therapy and then laser. And those things are both enhancing your existing stem cell populations. So they're basically bringing all of your own stem cells that are in dormant stages out into the woodworks. So then when you're bringing in the new population of younger, healthier stem cells, they can communicate and enhance your existing stem cells. So that basically at the end of the day, you're getting your own stem cells up leveled quite a bit so that they can help you fix things faster, rather than just letting the stem cells do their own work, or the new stem cells do the work. So you have the younger guys re-educating older guys, so everybody's on the same page.
That's great. And how long does the process usually take? Like, for example,
In
a
our
couple months or?
Oh yeah, in our clinic, the procedure itself is probably about 3 to 4 hours long. The stem cell IV part is pretty short. It's like maybe 30 minutes or so, not that long. But a lot of the IV treatments leading up to it add additional time. And then injections, depending on what we need to inject. Sometimes people have joint areas we'll inject as well too, just so that they get fixed as well. But if it's just like a systemic thing, then it could be just a couple of local injections I mentioned for the boost of the stem cells, and the rest is just IV. Um, then the procedure is done after that point, and then it's really up to the body to take advantage of the stem cells and do all the things that it's meant to do. That process can take place over the next 1 to 6 months. So the thing with stem cells, and also the use of the exosomes, which I mentioned briefly earlier, um, the stem cells alone, if you just put stem cells in the body, they have to divide over time, and as they're dividing over time, then they're releasing exosomes. So at the end of the day, what turns on all of the functions in our body, how the really stem cells truly work, is via the exosomes that they're secreting. So they're secreting all of the pure information, and these are proteins, mRNA.
Oh, looks like he froze a bit. We'll wait a bit for him to come back online. Oh. But so far, I hope that this is helping you. I know that stem cells are a very innovative type of treatment. So you can also put in the comments, just leave any questions that you have for him. And once Dr. Lee comes back, we can help answer it. But we'll wait for his connection to come back. Yeah, let me know if you guys have tried any other innovative therapies as well. I really love that IV therapy is also part of it, and that they really work on helping the body get better overall. So yeah, I'll wait for him to get his connection back on. Other than that, we're also going to talk about things like low dose allergy therapy, low dose immunotherapy. So there's going to be a lot of therapies that we're going to talk about. Put in the comments if you want us to discuss anything else, or if you have any other questions for us, and he's going to be happy to talk about it. Ozone, we've also talked about on a previous podcast before. We slightly touched upon it with Dr. Jess Petros. So we're going to cover that today as well. And hopefully that helps you guys. IV therapy, I'm not sure if many of you have tried it before, but vitamins are a really great way to help nourish our body again and get those nutrients back in. But another thing that we're going to talk about later at the end of the episode is also some of the testing methods to get to the root cause. Because even though we do stem cell therapy or IV therapy, ultimately it's still not really getting to the root of the issue. Even Dr. Lee had mentioned that these are ways that we can help speed up the healing process, but it's not really getting to the root yet. And so that's our goal, is to really get to the root of what's happening. Oh, he is back. Hi, Dr. Lee, you are back. Nice to talk to you. Oh, you may have froze again. Oh, there you are.
All right, okay. Yeah, somehow the internet at the office died here. So,
No worries. I'm
yeah,
glad that you're back.
okay.
So, yeah, before you got off, you said that it can take time for, once you get the stem cell therapy, it can take like 1 to 6 months for the body to regenerate, and we just let the
Correct.
body do its job.
Oh yeah. Well, let me continue where I left off. So yeah, the important part is that the stem cells, they work primarily via the exosomes that they're secreting. So it's just how the stem cells communicate with the rest of our body. So the stem cells release these bits of information via exosomes. The exosomes are just basically envelopes that carry information. So they carry either peptides or growth factors or signaling molecules, etc. The thing is, if you have a lot of these envelopes signaling, it can reach everybody in the body. If you only have a certain amount of envelopes, you can't reach everybody fast enough. But the nice thing about stem cells, over time, they reproduce, they make more copies of themselves, so that the factories, they're like factories that can generate more and more of these exosomes. So if you're just utilizing stem cells alone, it might take a little time, because stem cells divide over time, they ramp up, and then you eventually get a lot of stem cells, so you get a lot of signaling happening eventually. And then this process can take anywhere from a few days to a few weeks, even a couple of months, before things really ramp up to the point. This is the reason why in our treatments we also utilize exosomes, so on top of the stem cells. So we actually, in the fusion, we give stem cells plus exosomes. So these exosomes have already been released from the stem cells over time, so you're getting a flood and surge of information hitting your body more immediately. So this is where symptoms and changes in the body can happen over the period of even days to weeks, rather than months, to make changes. So traditionally with stem cells, it can take a couple days, couple of weeks, even a couple of months before your body really kicks into gear. The treatment combination that we do is it just shortens that time frame of when things can really happen. So in various cases, people can get almost next day, or the next couple of days, their skin is like amazingly better. So that's what can happen when you're really helping the body to fix all of the errors that are going on.
That's great. And how long do the effects last for? Like, for example, is it temporary? Does it only last a few years?
Well, that goes back to then the root causes of the issue. So if like let's say you have various things that are triggering the immune system, such as exposure to mold or parasites, um, if you don't really treat the parasites, they're still there. I mean, the stem cells will help the immune system to help you fight a little bit further, but you might need to things to actually kill them off. So they might calm down the immune system's response, against your skin, be the trigger from the parasites, and this, calming effect can last for up several months, even a year or two. It really depends, honestly, if you're not addressing those root issues, because people can feel great, and sometimes it's maybe a food trigger that is there, and sometimes the stem cells alone can actually mitigate that food trigger. So even if they're still eating the food later on, they may not have this response. But the thing is, we don't really know what the missing link is for the patient until we dive into it. So this is really a blanket treatment to get things better, get the immune system kind of back on track prior to the skin issues. But then the problem is if you don't fix underlying things, then comes back. So in some cases we've treated people once and we don't see them for a while and they're really good and they stay good. And some people they come back, or if they have to come back, maybe 6 months to a year, a couple of years later, just needing a tune-up or something.
Yeah, I really love how you stress that this is not even though it is an approach that can help give relief, but it is not getting to the root cause. And ultimately, we do want to get to the root issue, which we'll talk about later. We'll definitely cover some of the ways to get to the root issue. But this is a way to get relief in the meantime. How many times have you seen that some of your patients have come to see you for getting stem cell therapies, stem cell therapy more than one time? Like, for example, do they come 2 or 3 times,
It
or
Yeah, that's a good question because it really depends on the chronicity and the severity of their conditions. Because typically, if it's just eczema and it's just basic, maybe nagging eczema, but it's not anything affecting other areas of the body, those can be dealt with rather straightforwardly. But the people that also might have eczema, they might also have like joint inflammations. They might have chronic fatigue. They might have uh, GI issues. Some of them also are dealing with Lyme and mold conditions as well on top of these things. So it depends. The people that have more things on their plate, they do need more support because the body's just been through a lot. So that's where it comes down to, because the average population, eczema is relatively common, but the average population, they're just kind of getting by, and it's not bothering enough to want to do anything about it either. So it just depends.
yeah, that's very true, and it makes a lot of sense as well. So, for people who are wondering, do you have a rough cost of how much this treatment would cost someone?
Yeah, so the one I mentioned that includes like the laser and ozone and the stem cells with exosomes, that procedure that we charge is about $7,000. So it's a pretty hefty treatment for what it does, um, but it does a lot for the body. We have lesser priced stem cells, and typically just stem cells alone without the exosomes. That can range from like 1,600 on the low end to about like 3,200 or so. So like about half that price range.
Thanks for sharing. I've definitely seen I've seen someone who did a GoFundMe page before to help raise money to get stem cell treatment. So I've definitely seen people who have been trying to utilize it more. Now, I want to move into talking about some of the
Sure,
other
sure.
novel approaches that you do as well. I know you mentioned you do IV therapy in combination with stem cell
Mhm.
therapy, but how does IV therapy work when you're doing it on its own? And maybe you can give some background on what it is for our listeners who are listening.
Sure. Yeah. So IV therapy is basically intravenous therapy or accessing the vein. But when we talk about IV therapy, there's a lot of things that we can introduce into the body via your bloodstream. And primarily, we start off with nutrition. So vitamins, minerals, amino acids, even herbs, we can administer in an IV. And what this does is it gets the body to accept the nutrients more rapidly than typically otherwise than orally. Because some people who are dealing with eczema, they might also have leaky gut. So if you're trying to give them a whole bunch of supplements and herbs or amino acids, you might not absorb as much much. So the treatment process is going to typically take longer because the body can't absorb what it needs. So then your body just can't have the right nutrients to fix itself. So IV therapies accelerate that process by bypassing the gut, get into the bloodstream, and they can actually affect.
I think he froze, so we'll wait a little bit for his connection to come back on. But let me know in the comments if you've ever tried IV therapy. Oh, there, you're
Oh,
back
there you
on.
go. Yeah, I think the connection keeps going in and out of here. Okay, all right, sorry about
No
that.
worries. No worries.
Um,
The
yes.
part that before you got disconnected, you're saying it can bypass the vein and into the body. Oh,
So, um, let's see. Am I there?
and
Okay, just want to make sure I'm connected. Okay.
yeah.
Yes, the nutrients bypass the gut, so your absorption is at 100%, assuming that everything it works in your body properly. When they get into your system, then it kind of kicks on your general metabolic function. So you can start either detoxing more efficiently with the nutrients that are waiting to be utilized, or you can help regulate inflammation depending on what type of nutrients come in, or you also can enhance the immune system to fight various infections. So just the example of certain like IVs that we utilize, we can use like your multivitamin minerals. We can add in lysine, taurine, which have different like either antiviral effects or supportive detox and calming effects. High dose vitamin C, that's very good for immune function and antiviral, also slightly anti-infective treatments. We can use ozone in IV. Ozone has a very interesting effect that it actually regulates the immune system, but also helps your body to fight various infections, which is good for quite a lot of things. And also, in turn, it does activate stem cell proliferation too. So you can do quite a bit with the ozone therapy. And then we also have the use of our laser device. So this is relatively unique. We have intravenous laser, and this is basically you have a light directly in your vein. So there's a fiber optic cable that we thread in, and it's attached to a laser device that shines different frequencies of color into your blood, into your bloodstream. So the interesting about that is different colors of light also have different effects on our cells that are floating in the body. For example, the UV we know as a sterilizing agent actually helps kill bacteria, viruses, things. So if it's in your blood, it does the same thing. It helps to clean up your blood, so to speak. But it also has other pathways in activating, mitochondrial function, which is generating energy for your cells to do what everything needs to be done. There's like the use of blue, which is also antimicrobial, and then yellow, green, red. They all have different effects on either calming the immune system down or helping to generate more energy or supporting detox. So there's things that we can combine with the light that makes things even better. So I don't know how much time we have, but we can talk briefly about IV therapy. In the version of that, it's called photodynamic therapy, which takes it even a step further. So this is the use of various nutrients or herbs, and then they are activated by light to make them even more effective. So the one common one that we use is called methylene blue. Methylene blue is also very interesting agent on its own. It has very interesting properties on antimicrobial effects, on supporting energy generation ATP, a lot of anti-aging effects as well too. But it's also more potentized when you enhance it with red light. So in this case, we give methylene blue in an IV. We can follow up by using red light afterwards, which amplifies the effect of the methylene blue. But more importantly, is that if there's any pathogens in the body, like bacteria or even viruses, they actually uptake the methylene blue. And then when you shine it with red light, you're enhancing so much energy that they can't tolerate. So you're literally damaging and destroying their cells and their cell membranes and their DNA and RNA. So you can actually clear up any of the pathogens that are hanging out in your system just by that alone. So that's the use of light combined with the nutrients there, for example.
That's amazing. I've actually also, like the stem cell therapy, I've also been trying to get someone on the show to talk about methylene blue.
Okay, well,
So
good.
yeah, it's amazing that you talked about it. I first came across it on Instagram when someone was talking about it, and I saw that their tongue turned blue.
Mhm. Yeah.
So yeah, I'm so curious to learn more about it in general. Do you usually, aside from injection, but can people take it orally?
Oh yes, methylene blue is readily available orally. There's two forms or three forms that are available. One you might have seen like people's tongue turning blue, and usually those are like troches. They could just put it in your mouth and let it absorb that way. There's a use of the liposomal liquid tinctures. There's some just liquid tinctures too that are not liposomal that you can find on Amazon pretty inexpensively. And then there's also a prescription. There's oral methylene blue liposomal capsules, so you can swallow them. They don't turn your mouth blue at all, so you can absorb it and still have the effects without worrying about the blueness. Um, so once it's in your system, though, that's when it turns on a lot of things in the body. So, like the thing that it helps the most with is cognitive function, energy, and the immune system, because you're helping to actually bring down some of the pathogen burden that might be in your system. So that's where we utilize it for helping to treat various, either bacterial or even viral infections.
I know whenever I release a podcast, a lot of people want to do things and try it themselves, and they're going to see if it's going to work. So I'm going to have a lot of people ask me, is this something I can just grab as like a supplement and just do on my own, or do I need to do it under the guidance of a practitioner?
Um, it's best to, if you can. There is a book out there on Amazon that was written by a non-provider who does go into some detail about the methylene blue for people just to kind of start on their own. There's a little bit of misinformation on there, but the big gist of it is it's relatively helpful. So people can utilize that. I don't want to bring up the book name just to steer people in that direction, but it at low doses, it's relatively easy to utilize. Just be aware that people can herx from it, so they can actually have slightly negative reactions from there when they first start because of some of the die-off reactions, and or it's generating too much energy for the body to now process either detoxification pathways or start to do things that have been waiting for a while to begin. So it might be like they might be hitting too many things all at once. So people can get either headaches or body aches or sometimes chills and fevers, or just feel horrible for the time when they're first starting. So if they were to do it, just start really slow and low. Um, and if you don't feel anything, just you can do it for a little while. And then usually I recommend people to take breaks after, like usually if they do it for 3 weeks, to take 1 week off just so the body has a chance to clear out whatever's left over and start over.
Got it.
Those are
So
the simple things to begin with.
thanks for elaborating. And once again, I want to stress, as you were sharing earlier, that even though we can do all these things, our goal is to get to the root issue. So even though the IV therapy can help, we still want to figure out what's actually happening inside the body internally and balance that out. And we're going to talk about that later on in this podcast as well. But Dr. Lee, out of all of these types of IV therapies that you use, nutrients, laser, and ozone therapy as well, which one do you find to be the most effective when we're using it for our eczema patients?
I would say typically the ozone has the greatest utility of all of them, minus just the nutrients. If you're just deficient in vitamins and minerals, you got to start there. But after, let's say you have adequate amount of the foundational nutrients, then the ozone would be one of the best things to kind of regulate a lot of the inflammatory pathways, because it helps to control inflammation, but it also kind of regulates the immune system, where if there's kind of an autoimmune flare up, it does bring things down to kind of a balancing and modulating effect. And then if there's any pathogens, it helps the immune system to start being able to deal with some of those triggers that are there. So it kind of has the broadest effect on things. The other things like the laser and stuff are very specialized. They very much help as well too. It's just you got to know what targets you're treating, um, so that you can be most effective. I do want to bring up one thing that has been available in the past but not presently anymore is the IV MSM. So MSM is amazing for inflammation and healing the gut. And that in the past, when it was available, was pretty helpful in kind of giving more immediate symptom relief. Because if you fix, like when you get an IV of MSM, it's equivalent to taking like tons and tons of it orally. MSM is very good at fixing the leaky gut. So if you have, intestinal permeability and you can actually tighten up all the intestinal junctions, then you don't get a lot of things that you're eating into the bloodstream anymore, or pathogens into the bloodstream anymore. So if the gut barrier is more solid, the skin barrier becomes more solid too. So that's one of the things that can be extremely helpful. I mean, it's not easily available as it was before, and I'm trying to figure out how to get access to it again. But just bring it up that even oral MSM is great too, but IV is just because you can get a ton more in at once.
That's great. Yeah, I've definitely used MSM in the past as well, and yeah, I've heard a lot of great things too. So it's great that you have the IV component, which can be injected as well. So in terms of nutrients, how often have you seen that help someone's skin condition, especially if they are having flare-ups due to nutrient depletion?
Well, we usually like foundational. I like to people have like a multivitamin with additional minerals, including magnesium, because if you don't have those, just think of like an engine that's missing a handful of parts. The engine will still run eventually until it doesn't run so well, but if it's missing those parts, then it's going to break down at some point. And it's the same thing with our body. Like these key nutrients are essential for various functions. So magnesium is probably one of the more important ones because it does help with skin health, helps with like various detoxification pathways, over 300 known biochemical reactions that magnesium is involved in. So we can do simple blood testing to get you an idea of what your magnesium levels are. So that's kind of where we can begin for some patients, is we do some testing to get an idea of what their deficiencies might be. Not everybody needs to do the testing, but it is very helpful to give you targets to treat. So if you are absolutely deficient in, like, for example, vitamin C or magnesium, you can easily replete them with IV or oral if you can. Vitamin C is a big one too, because vitamin C has various antioxidant properties. It's actually a precursor for collagen as well. So if you have enough vitamin C levels, your skin can also get a nice boost from that alone. Not to mention just the immune system support that you can use to fight bacteria and viruses with vitamin C too. So yeah, there's a lot of nutrition. Certain B vitamins are also good for regulating skin health too. But that's where if you have the foundation and the body has adequately what it needs, things can work. So that's what we try to do, is we just want to make sure things are working properly.
Yeah, you're right. And just to stress, like if there's other things going on in the body, like you mentioned earlier, if there's mold, heavy metals, or parasites, simply doing an IV therapy alone with nutrients is not going to be enough to get to the root cause. So we're going to have to take it a step further. Before we talk about some of the root causes and some of the other things that can cause your skin to be flaring. We had a question. I'm not sure if you wanted to chime in on this, Dr. Lee, but we have Mel who asks, if scientists can cure eczema with Dupixent, doesn't that mean they know the cause of eczema? Just curious.
Well, so with the particular medication, it's known as a biological medication. So it impairs, or actually inhibits, various immune functions. So it's actually still a very nice band-aid for the situation. Um, your immune system is still like typically hyperactive, and what this is doing with Dupixent is it's blocking the signaling of that inflammatory pathway so that the body doesn't attack itself. Meanwhile, while you're on it, it's great. Like it'll work, but it has other things that suppresses your immune system. So you have other infections that might be there. Your body's just not dealing with those at the moment. So that's the tricky part when you're utilizing these biological medications, is they do work amazingly because they're just quieting down the immune system's response. But meanwhile, the disease process might have still been there. So let's say if you ever were to be off the medication, you're going to lose the benefit, and then in that case, things might come back. Sometimes a lot of people do flare up a lot more after they've been on there. Plus, there's other like side effects that occur down the road that they didn't really tell you about. Like you have increased risk for pneumonia or other infections that are there and tell you not to start these if you have various infections ongoing. So that's the tricky part about these medications, is they're sometimes great band-aids when you need a quick fix, but they're not meant to long-term wise. So yeah, of course, a lot of the medications in pharmacy, in the pharmacy, they're treating various pathways, but they're still not getting to root cause. They're nice band-aids sometimes. Sometimes they double-edged swords. Sometimes the side effects are worse than the actual treatment. So it's not the route that we would like to take. Sometimes if it's severe enough, if you need a quick calming down, then there's you can use them. But really, if we are getting to the root of the issues, we don't have to even touch them.
I completely agree with you. Thank you so much for sharing about that. Now, one other thing that you wanted to talk about was LDA and LDI. So, low dose allergy and low dose immunotherapy, and how it can help the skin as well. So, I know that our audience is probably not all of them have heard about this treatment, and I'd love to touch more upon this as well.
Okay, great. Yeah. So the low dose allergy therapy, it's simply a low dose of a lot of the common allergens that we are exposed to. So includes trees, dust, dander, pollen, foods, even certain chemicals that are in a single shot. And these components are actually diluted many, many, many more times than your traditional allergy shots. And it's also potentiated with beta glucuronidase, which is an enzyme that enhances the effect. So what it's taking are neutral. So they're not more, so you're not more heightened in immune response unnecessarily to various things. Because sometimes we have seasonal allergies. Your body's hyper responsive to pollen and dust, even when you probably shouldn't have to be. So LDA is a great treatment for that. It can actually calm your immune system down when you have all these allergens there. When dealing with skin issues, it could be triggered by those. Actually give your immune system a chance to down-regulate its immune response, so it's not attacking everybody left and right. So then in that case, oftentimes the skin issues can clear up because your immune system's not on high alert all the time. The nice thing about this is it's like a retraining for your immune system. So you typically can do the low dose allergy treatment once every 2 months. Each time you're stimulating white blood cells to enhance the memory of things so that it can actually remember. So usually after about 6 to 8 treatments, you might not need it anymore because your immune system has a memory of these things that it's not having to attack everybody here. So that's kind of the effect of low dose allergy therapy. And then low dose immunotherapy it's more specific. It's actually much more specific than low dose allergy therapy. In low dose allergy is that the low dose allergy therapy is basically hundreds of different allergens in one shot. The immunotherapy is more specific, and it depends on what type of agents being used. But the best example I can give you is the immunotherapy. They have different targets for different pathogens. So we would, in this case, we have anywhere from bacterial, viral, even medication or chemical agents that we can use in immunotherapy, and it's actually almost like a homeopathic remedy, so to speak. So in this case, if your immune system is responsive to yeast, and it's actually creating a hyper responsive immune response, almost like an autoimmune response, you would use low dose immunotherapy to quelch or calm that immune response so that it's no longer creating a flare up in regards to that particular trigger. So if you know that like candida or particularly is your causative agent, sometimes you don't know, sometimes you can just trial with it. But if you give yourself low dose immunotherapy of yeast, which has various fungal organisms there, your immune system can kind of neutralize and harmonize the immune response so it's no longer hyper reactive. And then that way you're not attacking everybody left and right, and the yeast are in your body are being appropriately dealt with. That's one way for the immune system to kind of calm itself down, and you're not developing eczema as well. So it can be used very specifically for these targets. And this is actually where, going back to like you mentioned topical steroid withdrawal when we chatted before, is it can be very helpful. The low dose immunotherapy can be very helpful for helping the body react to when you don't have steroids in the body. So you can actually use a low dose immunotherapy of cortisone or a steroid, and that way it's like bringing your immune system back to neutral before the steroids were there, because sometimes it's hyperstimulated or it's under functioning, so you kind of bring it back to like a modulating effect.
That's great. Thank you for sharing. How would you compare the low dose allergy to even homeopathic medicine? Because I know homeopathic medicine also contains diluted substances as well, but they work differently. But yeah, I would love your.
Well, they work slightly differently. Yeah. The difference is that using that enzyme. So in the low dose allergy therapy, it's injected along with the beta glucuronidase enzyme. The homeopathics, they can be used, and they're used quite well too. It's just the difference is the enzyme potentiates it, so it makes it last longer in the body. If you do homeopathic, sometimes you have to do them daily still, or a few times a day even, until you find the right concentration and strength that kind of tells your body how to function. Um, and it depends on the type of homeopathy too. Like if you're using constitutional homeopathy versus the just the diluted allergens, there are quite a few good ones out there too. I just you have to play around with it. Honestly, it's some people work really well with either way, but we've just seen in clinical practice that the low dose allergy therapy has been working. It's been around at least for like 70, no, not 70 years, but 1970s is when LDA was originally brought into development and utilized. So it's got some background with it in a more clinical setting here.
That's great. Apologies about the baby crying in the background. He just woke up from a nap. But so let's say someone comes to see you in your office. How do you decide if you give them low dose allergy or low dose immunotherapy or one of the different types of IV therapies that you use?
Well, that's where our consultation can be relatively detailed when we first meet. It's at least 30 minutes to an hour long just to kind of gather your history, where the triggers might be coming from for why you might have the eczema or other skin issues. The particular typically might be. And then, there's some, foundational things like, honestly, if the budget allows for it and you are quite, deficient in nutrients, IV therapy can be a easy, quick fix. Um, and if you're also dealing with other like the allergy issues besides the skin, sometimes just before beginning or before doing any of the lab work, low dose allergy therapy can be administered because it is a pretty simple process. It's just like a small little pin prick under your skin, almost like a TB shot, and that's good to cover you for 2 months ish, to begin with.
That's great.
So it gives you something in the meantime while you're trying to find stuff. Because sometimes that's a head start. Yeah.
That's great. Really appreciate all the different therapies that you're sharing. So let me know how much time you have left as well, because I know that you might have another appointment. But I do want to talk quickly, go over some of the ways you get to the root cause.
Sure.
And that depends on how much time you have left as well. If there's not much time, we'll just quickly skim through it. But yeah, just would love to quickly cover it.
Yeah, I think probably got like 15 minutes or so to spare. Yeah. So to start, the history taking is pretty important because we got to just delve into figuring out why or where you might have developed, the skin issues. If you can tie it in like to various, exposures, for example, a common thing is like mold exposure. If you think about where that began, and it just happened around that time, then we can kind of look into where we need to test for that. If there's other stressors like, the gut issues or life traumas, like, breakup or family, death or something, we can tie into those things as well. Sometimes if it doesn't if it happens out of nowhere, then we just have to start with some of the foundational testing. But the foundational testing typically, involves, blood work, which we look at some of your foundational things like your thyroid, your hormones, your cholesterol, some of your genetic markers like MTHFR, and that's kind of helpful for some general detoxification pathways. And then blood sugar as well. Then we look into the gut, because a lot of the starting points for skin issues would begin with the gut. So if you have, permeability or bad bugs hanging out in your gut, so this could be bacteria, parasites, yeast, things of those nature, we can do testing for them. Sometimes, with this gut testing, it's great, but it may not pick up everything. So sometimes, for example, parasites, they're pretty common. If we don't pick up on the stool testing, we might also consider treating just as a trial as well as a diagnostic there too. But then that's part of the testing to begin with. We do the stool testing, and there's organic acid testing, which is very helpful at kind of getting a look at some of the fungal activity in the body, as well as other urinary metabolites for your detoxification pathways and some of the growth of the mentioned fungus and bacterial things. So it gives you an idea that if there's fungal triggers, then we can treat those a bit further. There's additional testing for mold, toxin antibodies. Those can be done. Picture of the environmental burdens on the body too. So if there's, for example, if there's chemicals and heavy metals, those are not helping your immune system at all. So that could be another environment for some of these pathogens persisting in the system too, or just another reason for your immune system to start attacking itself. So there's testing to identify those things, and there's further testing for other immune-related, like inflammation or, for example, food sensitivities or immune reactions to various pathogens beyond what comes out in your stool. So sometimes if there's hidden, bacteria, viruses, parasites, even in your bloodstream, there is some testing for that too, because sometimes it's not in your gut anymore if it's, if it's been there for a while. So that's where we can really dive deep to figure out where those problems lie, and then we work backwards on treating what needs to be treated there.
That's great. Do any of your clients ever end up having a Herxheimer reaction where it gets worse before they get better, often when they start these treatments?
Uh, uh, Relatively common, because high alert when you're dealing with eczema already. So when you're doing things to treat, sometimes you might stir up more things, whether it's like if it's bacterial or pathogen based. When you're killing things off, they tend to die off and release more toxins. Or if you're detoxing them, you're getting their body to be able to move things through. Sometimes they might be moving through things through faster than they can actually excrete or clear them out. So we have to play around and help them to minimize those, but they do happen here and there. So we just have to work with the body, and it really helps to know where people are standing and how they're responding to let us know the intensity and type of treatments that they can do. Yeah, we didn't mention, like, sometimes, if they're not detoxing well, that some of the foundational work is making sure that their elimination detoxification pathways are optimized during this, because, like, going back with the skin is a large organ, and it's a large organ of detoxification too. So if you're breaking down your skin, you're probably not detoxing very well because it's not coming out through your other pathways like your pee, poo, your lungs as clearly. So things do tend to flare up that way too. So that's why sometimes if your body is really, really detoxing, you can actually get worsening of the eczema for a brief period of time before it clears up. Or the eczema can travel to different areas before it finally clears out too.
Yeah, thanks for sharing. I definitely agree with that. And I see that happen as well. We have one person who is asking, what is the success rate of being treated after root cause is diagnosed?
Well, once we treat what's in the root cause, then the success rate is extremely high. The thing is, the treatment to get to the root cause sometimes it requires time, and sometimes if it's because supplements, it's financially as well too. And sometimes there's emotional work that needs to be developed. So if there is like either resentment or trauma or something, those do need to be looked at too. So as long as the patients are working towards that, things do get better. It's just you got to figure out what the weakest link is and what areas need the most attention. Um, Once you get to those, there really should be normal roadblocks along the way. So in this case, the success rate should be really high. And in my experience, it's generally really high. It's just we got to make sure that they're following everything that they can, whether it's my plan or whatever else that they need that's not, being addressed.
And I think one thing that I find a lot too is because how you mentioned the Herxheimer reaction can occur where it gets worse before it gets better. I think a lot of times people get discouraged about whether the treatment is actually working.
Right.
Yeah.
Yeah, you're right. Whenever it flares up, it's a good sign, even though it feels bad. In naturopathic medicine, there's a like couple of principles, and sometimes when things respond, whether you get more sick, it's a sign that the immune system is responding in a way. It may not be the most tolerable way, but you have to understand that there's a pathway towards healing. It's a continuum of health. Sometimes
Mhm.
people who we see, they're on the side where they're too sick to get sick, and once you start getting them better, they start getting actually sick again to the point where they cross over the side of being more on the optimal side of health. So that's where if you're on the like disease state and not healthy side, and you start crossing over, you start getting really actually sick that you may not got sick before. That's something to keep in mind as you're trying to get to the other side of being
Mhm.
great health. So that's kind of something to look into as well.
How long would you say on average it takes your patients to get better? And I know it will also depend on how long they've had this for as well.
So it's this kind of like a rule of thumb, like for however many years that they've been dealing with issues, it takes approximately about a month or so per year. I mean, that's just, a ballpark, but, some people take longer or shorter than others. But, the body needs to reverse, some of the disease processes. Sometimes, it depends on the health of your stem cells. If they're doing their job and they're not overburdened by other things, then they'll do it appropriately. And sometimes it's too slow and it still takes maybe even more months on top of that. So that's a good question. But the ballpark I can give is, however many years you might consider a month or so per year that you've been dealing with these issues. I mean, there's no exact answer, but that's kind of the trend.
We just did a podcast on how long it takes for your skin to see improvement and healing as well. And we gave the same answer where it can take about a month for every year that you've had this condition for. And yeah, I really appreciate
Right.
all the testing and how thorough you are as well in terms of getting to the root cause. We do a lot of similar things too because I think it's really important to investigate what's happening at the root issue that's causing the flares. Someone says my son had eczema until 12 years and now he has HS at the age of 19. Is it related?
Likely, yes. HS, I think I've seen underlying is actually mold as a driver for that. So, mold can cause gut dysbiosis, it can cause intestinal permeability, and then it can also lead to those as well too. So I think really looking into if there's been any level of mold exposure in the past, and then get to the root of helping the body either kill off any of the fungal organisms that are left over, and then maybe detoxing and obviously changing the environment if it's still there. That'd be a starting point.
Thank you so much for sharing. And I know we've reached the end of our time, but I really loved and appreciated all of the information that you shared. Any last words or things that you want to share or word of encouragement before we head off today?
Yeah, of course. I think the biggest thing that we briefly talked about it as the power of the mind, mind body, because if you have the right thought patterns, that helps a lot in the healing process. So if you believe you can heal, given the right tools and everything, it's going to make things happen. Sometimes just the belief in being able to heal without even doing all the work can get you to the end point anyways. So it doesn't cost anybody anything just to have the thought and the hope that you can heal. So if you spend 5-10 minutes a day just visualizing, for example, if eczema, visualizing the skin and the immune system clearing up as detailed as you can get, and emotions that tied how you would feel when your skin's great, and you just kind of focus on that part, the body has a kind of a blueprint to follow to get there. So, you still maybe need to address some of these other things, but it just makes it happen faster. So that's one of the things I tell people with any of illnesses that we treat, is to use your mind and helping you in that part, because you got nothing to lose, honestly. I mean, if you didn't, I mean, you spend a few minutes of thinking about feeling good, which is not bad, but if it does help, it's only going to make things effective, or more effective along the way, and it's free. Doesn't cost you much.
Amazing. Yes, the power of the mind is so powerful. Thank you so much, Dr. Lee, for being on the show today. And thank you so much, everyone, for tuning in and asking your questions. I hope today really helped you. And don't forget that you can check out our podcast on all the podcast players out there. And thank you, Dr. Lee. You've been a wealth of information. So we really appreciate you for
Thanks,
coming on the
Abby. Thanks for
show.
having me. Yeah, it's
Take care, everyone.